Welcome to One Take Live. I'm Monica May. September is Prostate Cancer Awareness Month, and along with that topic, we're going to be covering colon cancer this evening. And with me, I don't want to say partner in crime, but he was a doctor that I could go to for years when I needed physicians to help me run the clinic portion of Take a Loved One to the Doctor Day. He helped me service so many brothers. And I'm sure that there were a lot of men that were like, oh, here comes Dr. Chris. And they would want to put up their fingers too. But listen, it's something that we have to do, the one finger. It's something that you brothers have to do. But Dr. Christopher Scott, that was then, this is now. How have you been? Now Senior VP with Envision Health Services. What does that entail?
So I've been good. What it is I oversee operation, fiscal, and quality assurance for about 25 facilities between Central and the West Coast of Florida for HCA systems of emergency rooms, besides working clinically as an emergency room physician. So, a lot of juggling of profit and loss sheets, a lot of making sure we have the proper protocols and things in place to make sure that patients get the appropriate care in a safe and efficient manner.
A 1998, I believe, Howard graduate. Yes,
92,
yes.
92,
92,
92. 98. You are correct. 98. I'm
Okay.
dating myself. 98. That's correct. Howard Medicine.
I read my notes a little bit, you know what I mean? So where are you from originally? I've always wanted to ask you that.
No, absolutely. I'm Jamaican. You should know that. Raised in New York City. So, that's my history.
And then you wound up down here and doing some wonderful things.
Right.
When it's all said and done, Dr. Chris is really a community kind of guy. And he makes the world that we don't understand in terms of medicine come to life because he's able to have those heart-to-heart, one-on-one talks with brothers and just brown and black brothers. One of the things, Dr. Chris, that we want to get over tonight is this fear that brothers have about having that dreaded prostate exam. Let's talk about that. Got to do it.
Absolutely. So, ourselves as a community of both, African American, the term Caribbean American, whatever term you want to use, we have a fear of just knowing about our health and knowing the unknown. It's one of those things where if it's not feeling bad to us, we don't want to know about it. We're just going to let it ride. And then you have all the false misnomers of a exam dealing with the rectum, be it for colon, be it for prostate. It's going to hurt, whatever you may associate it with, that leads to an apprehension to go and get tested. And unfortunately, these are disease states that they will stay hidden for a long time before you are symptomatic or showing signs. And by that time, as they say, the horse may be out the gate. You may be behind the time. So screening is really the best preventative measure, and it leads to the best outcomes, which entails
typically, I'm sorry, Dr. Chris, typically we would tell men to wait until they're 50, but for African American men, it's a little different. What age should they have their first prostate screening?
So 45 has been lowered for, we'll just say, people of color in general, 45. We have certain genetic predispositions. We have certain socio predispositions that will lead us to need that screening earlier to make sure we have a head start on things. So 45 is the recommendation.
So 45 would be the recommendation. Something else that has come up, and it's a little bit of a this way or that way, is that men don't need the digital rectal exam if they've had the blood exam or the blood exam and, da-da-da-da-da. You say both or one or the other?
I say both. The first thing to realize is that, all these lab exams have a low range, an acceptable normal, and a high range. The thing about the PSA, if we consider 2.5, we'll just leave that number as the medium cutoff range. There are persons that can be below that range and have prostate cancer. There are persons that will be above that range and be perfectly normal. There are different things that can cause that number to be elevated. What we look for specifically is a change in the number, and that's what's important. So to give you an example, someone who's been running along at a number of 1 for several years and all of a sudden has a change to 1.7, 1.8 needs a digital rectal exam. It's just, the way it is, because the test is what's known to be sensitive. It's not specific to prostate cancer. So the best way to check it out is to have a digital exam by your physician or healthcare provider.
Mm-hmm. And when we come back in just a moment, we're going to tell you what you can do if you are unable to afford that. Healthcare is also a prevention for brothers from getting the test as well. We have a way to take care of that for you. Check this out. Wow, that's a heartbreaker right there when you see Chad's picture up there. We're talking with Dr. Christopher Scott. September is Prostate Cancer Awareness Month, and prostate and colon cancer run neck and neck almost in terms of testing and in terms of predisposition for African American and brown brothers too. What we're trying to get you to do through the Center for Change is to know your risk factors. What are some of the things that can cause let's talk about prostate cancer first, and then we'll go back to colon cancer. What are some of the things that can cause it?
Well, let's say some of the things that put you at high risk.
High risk, okay.
So things that will put you at high risk, first of all, being a person of color, there are certain genetic predispositions to making you at high risk for catching that. That's one of the reasons the age is lowered for our people. The other one would be obesity, smoking, things like that. Anything that causes the prostate to what we call become inflamed and shrink, inflamed and shrink. So that would include sexually transmitted diseases. That would include infections of the prostate, prostatitis. And there's been some loose associations. So studies are still out there around vasectomies. Any surgical procedure around the area can cause inflammation. So
I did read that recently, that vasectomies could be one of the catch-alls there too.
So, wow. Studies still to be proven, but, just want to make sure I mention it.
Mm-hmm, mm-hmm, mm-hmm. What would be a sign for a brother to know that, something could be wrong? Could it be going to the bathroom more often or not feeling like they voided all the way? What are some of the things?
Sure. So here's where a lot of people get a false sense of security, because there's also something known as benign prostatic hypertrophy, or BPH. Both entities will cause increased urination by virtue of you not being able to empty your bladder. If you think of the prostate as a walnut gland that wraps around the tube that you urinate through, when it swells and gets tight, your bladder is unable to void completely. And so leftover urine in the bladder causes you to go to the bathroom more frequently. It'll cause you to have to strain to get started at times. It'll cause you to stop urinating prematurely, as well as it can cause things like painful ejaculation, blood in the semen. So these would all be things that you would look for. Increased urinary tract infections in men is also something that we look into, because unlike females that have urethras, the urethra of a male is several inches long. So it's not normal to get what we call urinary reflux of infections going back up into the bladder, unless you're not emptying your bladder frequently. So those are all signs that we look for.
Okay, all right. When we talk about colorectal cancer, and that's one of the things we're also going to be talking about in our doctor's webinar, Know Your Risk Factors for Prostate and Colon Cancer. It's coming up September 23rd, and we'll show you another commercial so you'll get a chance to see that the sign-up code. But constipation is one of the signs of colorectal cancer, diarrhea, oddly shaped stool, they say, difficult bowel movements, abdominal discomfort. The list goes on and on and on. And we'll talk more about that coming up on September 23rd. But what are some right away things that should send someone to the doctor? And just like the prostate exam becomes a part of a man's physical, is that true? When they're having their physical done, is the test for colon cancer a part of that as well?
Yes. Now, the thing about colon cancer is it can have even some lower associations depending on family associations with certain things or previous medical treatments. So the first to answer your question, anyone seeing painless bleeding in their stool, that's a big yellow flag. Go emergency to your doctor and have that investigated. As well as the other things that you alluded to, changing what we call stool caliber, change in consistency. You want to have those things investigated. The age has also been lowered.
Okay, to
45, and in some cases 40 for your first screening exam for colon cancer. We're specifically talking about colon cancer now. But the difference is you have to realize that there are two pathways for colon screening. There's what's called kind of the stool evaluation, and then there's what's called direct visualization. Stool evaluations, where you basically take a card, and there's a few different methods of it. You take samples of your own stool and send it in. They're quite easy. They can be done in the privacy of your home. They're very what we call sensitive to pick up the presence of blood in the stool that's not visible to the naked eye. We have tests that will get that, but there are several things that can cause blood in the stool. So they're easy, therefore they can be done quite frequently, yearly or bi-yearly, but they will always lead to, when positive, the visual exam, which is done by sigmoidoscopy or full colonoscopy. So all these things lead to the other. The problems with the other one is they'll involve a full doctor's visit, anesthesia, and they come with other risks. So they are usually done at an interval of 5 to 10 years, as opposed to annually in these things.
It's interesting. Chadwick Boseman was 43. He passed just recently, and he had colon cancer, stage 3 and then 4, for 4 years, and he was living with it. And to us, he looked virtually healthy. Is colon cancer something that is generationally predictable? Is it something that, did he know? Did he have symptoms? Did it go neglected? What do you think?
Okay, so first of all, let's talk about, is it genetically predisposed? When you mention, is it generational? And the answer is yes. There are actually several genetic entities. I'll name one, familial adenomatosis polyposis, where the intestine of these patients basically look like many fingers down a long tube. And as you alluded to, and as I said before, you may be what we call asymptomatic for years. You mentioned staging, which for all intents and purposes denotes the location of the cancer within the tube, how far it's gone through the wall, or has it eaten its way out. So you can be stage 1, stage 2, totally asymptomatic. You're starting to get outside the wall, stage 3, maybe you're getting some problems, and by 4, it's gone awry. So that again denotes the importance of early screening, because you want to get these things when they're in the stage 1. That will give you the best what we call prognosis. And the longer you wait, is the further these things will erode from inside a tube to coming outside and spreading all over the body.
Dr. Chris, we're going to stop right there. We're going to run that commercial one more time. We're going to welcome people back September 23rd for a more extended conversation on both colon cancer as well as prostate cancer. Why are we talking about it? Because if we don't, who will on One Take Live? Dr. Chris, thank you so much.
No problem.